All right. Hello, everybody. Thank you for joining us tonight. Um, the session will be recorded, and this is our first of a series of educational sessions that we'll have once a month. The purpose of this will really be to try to make more space for connection and get some of the questions and the education out of the way, with the added benefit of some of our expert speakers. So I'm going to share my screen here. Um, all right. So tonight we're going to we're going to have just a very kind of brief panel discussion about advocating for care in PPA and PPAOS. Sherry, I see your hand up. Let me navigate, make sure you're okay. Please hold. Sherry, if you need anything, you can drop it in the chat here. I'm going to start intros, but then I'll come check the chat right after this. All right. So we will talk about just accessing appropriate care in PPA and PPAOS. We have Morgan, Mike, and Zach with us tonight, who can all offer various perspectives. And Tara is here with Morgan tonight as well. And she will be popping in and out as she pleases. Okay, Cherry, you're good to go. Got it. All right. Okay. So we've framed these questions around some work that was done by Anna Volkmer in the UK. She is a speech language pathologist and a researcher, and she works very closely with the PPA community, people living with PPA, and care partners of those living with PPA. And in 2025, she did a kind of an overhaul of like what's going on out there and how can we fix it. And they came up with, um, their own colleagues came up with 7 care pathway recommendations. Um, these are things that I think are they should be in place already, but somehow they are difficult to get in place. So we'll frame our discussion around this from the perspective of our guest speakers. Um, the care path recommendations are, the first thing is there's just not enough information that's easy, clear, and accessible about PPA. So professionals should be who have expertise in PPA and PPAOS should make those materials available. When delivering the diagnosis for care pathway recommendation 2, when someone is told that they have PPA, doctors should speak clearly and plainly and in a way that is accessible for people with PPA and PPAOS, as well as whoever else is in the room with them. At that initial encounter, care pathway recommendation 3, from the start, care partners need support too. And so, in the medical system, we really focus on the quote patient, but I think everybody here can attest that PPA and PPOS is really a diagnosis for the whole family. And so everybody within that unit needs care. They also recommend that the same providers should stay involved over time, in that speech language therapy should be given by an expert speech language pathologist in PPA and PPOS. Much easier to say than to come by, isn't it? They also recommend that people should be connected with a team of specialists, care partners, people living with PPA should have an entire team of specialists that are familiar with PPA and PPAOS and that have strategies across the different areas of specialty to help support families and individuals living with PPA and PPAOS. And finally, we need to have some mechanisms and some pathways, some ways to get people the support that they need outside of the medical team too. And some people kind of already have a large community that they are able to draw from, but oftentimes, you know, you've been a little busy tracking down a diagnosis. And so sometimes those connections aren't as strong by the time we're like, okay, we know what's going on. We know why it's going on. Here's what we're going to do about it. And that's when the team really needs to come together. And professionals should be helping individuals sort of um, gather that team together and give people the supports that they need. All right. Looks like we lost Zach there for a second, but we'll get started. um, so I'm going to ask, we'll guide this, or we will structure this around some specific questions, but please feel free to, you know, this is not, we don't have to be terribly structured about this. I've actually been really looking forward to having Morgan and Mike in the same room because I think you guys will just get along swimmingly. Um, Zach will be on. He's going to restart. So when he jumps back on, we'll have him introduce himself. Um, but in the meantime, well, there he is, Morgan and Tara. Do you guys want to start? Or Tara, you don't have to introduce yourself if you don't want to. You're welcome to. Um, but tell us a little bit about you and the background that you're coming from, the expertise that you bring to tonight's webinar.
Yeah, some background on Tara and I. We're both educators. Tara was 25 years with a school district, everything from special ed to tech support. I'm in my 38th year of public education, most of it elementary teacher and a principal, and now I'm kind of a consultant for 13 school districts in the area. So we bring a lot of care and compassion about
Mhm.
people anyway. We've been married 28 years, something like that. So we know each other a little bit. And as you know, we talk about this diagnosis, and I think you were diagnosed about 2 years ago. You were two and a half, yeah, 59. So it was early, but we'll talk more about that. But from a caregiver point of view, just having a deep knowledge of somebody and knowing something was going on and not knowing what, and being able to connect, especially with Kiiya and experts, was just, uh, it took a lot of worry off my head of what was going on because we live in a somewhat rural part of Oregon. So having specialists close by is a bit of a desert. So I'll stop right there for now.
Thank you. They actually live in the same town that Marianne Casilio is from. Fun fact
Really?
for those of you who
That's right.
know there. I think most of us are on many of her papers and work closely with her. Um, Zach, would you like to introduce yourself next?
Sure. Can you hear me?
I can hear you.
All right, good. It's working this time. I'm Zach Dewall. I'm a speech language pathologist, really focused within outpatient neurological rehabilitation here in Nashville, Tennessee, both in private practice and at Vanderbilt Health. In my seventh year, practicing within that setting, and yeah, spent a lot of time treating people with the diagnosis of PPA, as well as working through some of the more diagnostic side of PPA as well.
I'll say Zach is a fan favorite, and I work on in the clinic that refers to his clinic, and um, definitely a big fan favorite. And last but not least, Mike.
Sure. Well, thanks. My name is Mike Riesthal, and I'm a speech language pathologist as well, and a professor in the Department of Hearing and Speech Sciences at Vanderbilt University Medical Center. I worked with Zach for 7 years, I guess
Hmm.
now,
Yeah.
and actually have learned a lot from his clinical expertise and creativity. Um, I am I work with Kiiya as her primary mentor in her PhD program too, and also I've learned a tremendous amount from Kiiya and her clinical experience that she has brought to the research world in this space. So I'm glad to be here today.
Thank you all for coming. All right, we'll jump in. So, Care Pathway Recommendation 1 calls for raising awareness and developing tools to support education around PPA and PPOS. Um, a question really for all, like, what educational tools do you wish existed for PPA and PPAOS? And or are there tools that do exist that you can recommend? Popcorn Mike.
Yeah. Well, I was going to say I'm not on the as clinical as I used to be. So I'm curious, actually, like from Zach, I'm not putting you on the spot, but like from your standpoint, like, well, first of all, if I go back to when I was in more of a clinical role, I think it would be very useful to have kind of uh, obviously, ready-made materials that can be that are aphasia friendly and communicate the kind of primary issues that arise in PPA. I think the biggest challenge when individuals are newly diagnosed is um, where to start in terms of education. Um, it is possible to provide way too much information at once. I've done that in my career, not necessarily related to PPA, but in other diagnoses where I've, you know, wanted to show that I knew a lot about the
Mm.
particular diagnosis, and that was a really bad idea. And so, materials that provide information in a in a manner that is, I think, more easily digestible, and also not demotivating. Because I feel like, especially with diagnoses where um, progression is expected, um, too much information or the way that it's presented, right? It needs to be presented in a way where we highlight the fact that people can improve in terms of their communication, their interactions in their community. And that's going to look different depending on where they are in the process. And so I think information early on that helps us present this information in a clear and as positive a fashion as possible.
Yeah. Um, Zach, do you want to follow up on that?
Sure. Yeah. Um, I think that in my practice, I have sought out that type of information, that type of handout or infographic or anything to that effect, and I've always been underwhelmed by what's been available. Pre-made, prefabricated, and I've also felt like patients have not been, the few that I've found or that I've tried, the patients have been like, oh, thank you, and then it gets tucked into a folder, and then it's not really reviewed again. Because it's just like Mike said, it's just often too much all at once. So I've always approached it, at least since I kind of sorted things out, to actually just put a blank document up in front of the patient and their family, and we go through sort of word by word. Why is it called primary? What is the progressive, and what does aphasia mean? I think getting down to that level has been really helpful for a lot of people. Um, so yeah, as we go through it and provide the education, being able to build it in real time, that at the end of the visit, I'm printing it and providing it to them. It allows me to really tune it to both the patient and the spouse's sort of like current level and current understanding. Um, I don't know. I think that that's been a really positive change for me, is just to kind of build it in real time. Yeah.
Yeah, I like that point. And Zach's the population that we serve in the area that Zach is serving too, you get really a whole variety of comfort with medical language and medical knowledge. So I like that
Yeah,
strategy.
medical literacy, it's on its own can just be such a huge
Mhm.
range, to use the terminology and how to adjust that therein. But then the different levels of severity, the different levels of, I think to not be demotivating is a good point by Mike. And so there's different sort of stages of, I just got this diagnosis, go easy, versus I'm ready to hear everything that you've got to offer. So, yeah.
Yeah, there's a lot of kind of variety in what people
Mhm.
come to the table with around that.
Yeah.
Morgan.
Uh, Please jump in whenever. When we realized that something was just going on, um, I had I had never, I don't think either of us had ever heard of PPA. So you have this huge umbrella of Alzheimer's, and then you start digging down to dementia, to then working down to PPA, and then logopenic, and you have this, and so it was very easy to be overwhelmed and going down a rabbit hole of and this was actually said to me, not by anybody in this group. Well, it's a 9-year slide. And
Mm,
like,
yeah.
okay, to what? And that's not necessarily true. So, but that, starting off with that really overwhelmingness, that I'm a big believer in big picture and then small bites. And
Mhm.
so when we think infographic or information, I'm very visual. I'm an elementary teacher. So that big, literal umbrella picture of Alzheimer and then how it spokes down
Mhm.
without getting too morbid about, what's going to happen years from now, uh,
Yeah.
has been helpful.
Yeah.
But yeah, at the beginning, I had no clue even what this was. And so I think that complete awareness and being able to big picture and bite size individually one-on-one, like you were saying, Zach, or some kind of graphic that can gently guide people into this is
Yeah.
super important.
Yeah. Yeah. It is a question that I hear, I think, the most often. Well, I don't know. I don't know if that's fair to say, but I do hear often, like, what is the what is the timeline, or what is the trajectory, and it's I can't provide a good answer. What I've been able to answer with in the past has been more, you know, I've seen a number of people, and it comes from here or here, and kind of different ends of the spectrum, and yeah, it's all very, very variable.
And Zach, I appreciate that trying to keep it, singular to the person and not getting too, you're all clinicians, but at the same time, not being too clinical and how, everything is brought to it differently by different people and how it's affecting them.
And I
Yeah,
think
that's
too, when we think about, I'm sorry, Kiiya. I was going to say
you go.
when we think about, presenting info, Morgan and Tara, when you hear something like a 9-year slide, I mean, first of all, it's a terrible way of
Yeah.
portraying it,
Yes,
right?
it is.
It's a terrible visual, but also it's focusing solely on, um, when we think of prognosis, like in medicine, oftentimes the prognosis is like mortality driven, right? And we're not, that's not our focus right now, right? And as a speech pathologist, Zach and I and Kiiya are, um, that is not what we focus on. We aren't doing anything that's going to impact um, that type of issue, right? The prognosis that that we can provide is actually um, way more, I would say, positive or uplifting in the sense that we can say we're going to be present if you find a provider, right, that understands how this works, right? That's another question, I know, but you know, um, we can talk about what can we do to support you now, right? Because we know that individuals who have the diagnosis of PPA can improve on particular tasks or in terms of communication, right? Using strategies and so on. But that those strategies may change over time, right? And that's why we want to maintain this relationship, right? So that we can adjust as um, as there is progression, right? And so there's a way of couching it in a way in a manner that, you know, uh, acknowledges the fact that there is expected decline, but that there are things that can be done along the way to try to maintain uh, engagement with family and community, participation in life, um, that that is not focused on the endpoint, right? We all have an endpoint, right? I mean, for all of us, and we don't get up every day and think about that, you know. We think
Yeah.
about how to engage day to day.
Yeah.
If I can touch on that a little bit, and then getting back to that term that was used for us, and one of the first visuals either I found or somebody gave me was literally like a curve saying, well, you're probably about here,
Yeah.
and here's the 9-year slide down to here. And that was horrifying. And what I've appreciated about when we finally found people who are knowledgeable and help us is what are we going to do to interrupt that downward cycle so we can continue to flatten it. And we may or may not gain things back, but what can we do to maintain current levels
Yeah.
of communication and abilities as that happens?
Yeah.
And working with Kiiya, because I'll keep singing her praises, she's been able to provide that, and how we can in our daily life, in our own community, with our own friends and families, provide things that continue to build and support. And that's been game changing, rather than it just be a shut door and you're locked in your house with this. What can you do? What can Tara do on a daily basis to continue to improve or flatten? And then what can we do communally to make sure we're still getting out, we're still seeing all those very important things.
I'll say too, but like we don't do any like billable speech therapy, right? Like we have social groups. We did a Stephen King book club for a while. So just engagement. That was my first time reading Stephen King because I was too scared before. Um, but it just had,
Read the Kennedy one that just came out. So that's a different
oh,
topic.
perhaps, perhaps we'll have to have another book club. Um, but it was just something that came up in like a social group that we had on another day, and a few people really liked, and that really jived well together, Tara being one of them. Um, fun. We have a fun group. Both really like Stephen King, and I'm like, let's read it together, and so it doesn't have to be lexical retrieval cascade or script training. And that was really not where you guys were at that time. I'm still not there. Like you just won't get as much bang for your buck through some of that formal stuff. And so, I would just encourage everyone to don't be scared to get creative. Um, all right. And I'm going to skip around a little bit here. We're going to go to Care Pathway Recommendation 3, which is supporting care partners from the jump. And unfortunately, care partners are not really woven into the clinical operations. And so a question for everybody, like practical tools, supports, trainings, just tips and tricks that from each of your perspectives, either as the care partner or if somebody close to you suddenly becomes a care partner of somebody living with PPA, like what do you tell them? That inside knowledge. You want to kick us off, Morgan? I feel like you've got
Sure.
stuff to say.
Um, I appreciate that thought, and I think it's always easier to, you can always tell somebody you need to take care of yourself. And most people I know really do a very poor job of that. And especially during initial phase of diagnosis and treatment plans. And even before that, trying to navigate 9 months of insurance denials for a FDA approved drug specifically made for this kind of PPA. And they just kept saying no, no, no. Um, and a little bit of a political, I truly believe sometimes insurance companies just keep saying no to wear you down and you give up. Uh,
Mhm.
and I'm a bit dogged on that. So it's hard to take care of yourself when you're trying to create a supportive framework that at any moment can just be ticked away. But now that we're, more, kind of formally into treatment plans and care partners and all of that, but it's really hard to do and it's easy to say. So I'd say whoever's listening out there, to support a care partner, don't wait for them to ask. Please be more dogged in just saying, I'm taking you both out to lunch, or we're going to do this, not just like, please let me know what I can do, because that just falls apart. People's lives are busy. They mean well, but uh, to support both somebody who's diagnosed and a care partner, people need to be much more just direct in how they're going to support. Like, no question about this. I'm bringing dinner every other Wednesday. Uh,
Mhm.
because otherwise it's well-meaning, but people are busy.
Yeah,
And
I
you
think it
find
would be
that
hard
if
to
if
ask.
if someone's asked, like, if they ask, well, tell me what, they say, tell me what I can do to help. It also then puts the burden on the care partner
Yeah.
to,
I'm much better about that. But at the beginning, I'm like, oh, whatever, we're,
yes,
whatever. But now okay, if you're going to ask me that question, this is exactly what you can.
yes, yes,
But that took a long time for me. Because, I'm Tara's partner, life partner. I got this.
yeah,
Uh, that just goes so far before your tank is just empty.
yeah.
So to support a caregiver, just be loving and direct in how you're going to help.
Oh.
Yeah, as I'm thinking it from, clinical side and how I'm practicing with both the patient and with the spouse or family member, son, daughter, caregiver. Um, I think my approach is more of how to keep communication happening. It's more of a focus on the actual communication. So that's often where I start. Is doing a bit of a combination of like cognitive communication strategies plus the supportive conversation strategies for people with aphasia, and really kind of building those things up together and doing some practice therein to try to keep, there's a level of frustration on the patient's side, but a level of frustration on the caregiver side too, of just, it's so hard to communicate in this context. And if I can lighten that load a little bit, then that's a positive thing. Um, yeah, as I think too of, maybe this gets outside of the PPA world, but with some of my patients and with their spouses, it's like that can be 1 hour where the spouse can just go sit in our waiting area and stare at the wall. So it's like I'll do some therapy here, even though a lot of the PPA sort of approach for me is both patient and caregiver. It's like, I got it today. Yeah, I'll bring you in. I'll kind of do a review at the end, but you get about 45, 50 minutes to just sit and maybe do nothing or make the call you need to, or use one of our cots to take a nap, which is happening.
That, if I practiced in a physical space, I would have a nap room. Great
That's genius.
idea.
Yeah,
Yeah.
yeah,
Um, yeah, and I I don't know if you guys have had this experience too, but I've people that I work with, and some of the other colleagues that I have, I know like work directly with the care partner themselves only sometimes. And
mm,
then I have some people over Zoom too, like the person that comes in to, go out and do things with the person that's living with PPA. The computer, the only place I do formal speech therapy is California. Um, and so over Zoom, that can be difficult for some people that depending on what their cognitive status is. But I'm like, she puts her AirPods in and I turn my camera off and I'm just like in her pocket and kind of, giving her the cues. And then also trying to convince her to become a speech therapist because she has just really taken it and ran with it. Um, what about
Yeah,
you, Mike?
I want to
Oh, yeah, go
address
ahead.
I want to address Zach's comment because that takes such practice from a caregiver's point of view. And to be honest, I enjoy Kiiya and Tara's groups so much that I'm sitting behind the screen in the next chair, and there's been times where Kiiya's kicked me out of the room. It's over the screen. I'm like, sounds like, I'm trying. I think I'm trying to help Tara because that's what we do, and I'm not.
Yeah.
Um, I'm getting in the way and not allowing her. I'm finding that line between being supportive, letting somebody struggle a little bit, and cognitive dissonance, without then as a caregiver watching that frustration and thinking, I got to fix this. So yeah, now
Mm.
I just straight up just leave the room, but Keel will hear me from the other room like yell and answer. Uh, so it is that constant push pull
Yeah.
between that.
So in the beginning too, though, like you guys are that's real life, right? Like when you
Mhm.
guys are out in your community, like you're giving each other cues and jumping in and pulling out. And sometimes we talk about like you guys already had this. I didn't need to tell you this, but like a little sign, like, all right, like I'm calling in the reserves, like come help fill me in here. And so I do think there is benefit to that as well. And so he doesn't get kicked out all the time. But once I was like, all right, you guys have this strategy down. Let's add another layer here.
And Morgan, I appreciate you bringing up that example because I was thinking of um, two cases in particular where the individual who had PPA was seemingly very comfortable with the communication issue that they had and were willing to put themselves out there in the community and talk to individuals and struggle. And it was way harder for the caregiver, right? And even had, in both of these cases, the caregiver say, he likes to go to this like event and there are a lot of big people there, a lot of, well-known people there in the community. And I know he struggles, but I don't, I think the spouse was more concerned about like the perception that these individuals may have of her husband than his enjoyment of it. He was not concerned about this in the slightest, and that was a real challenge in trying to deal with it. To kind of counsel her because it was coming from a real place of concern, right? Like she didn't want to see her loved one struggle, and she didn't want to see maybe his reputation in the community changed by the difficulty that he was having, right? Meanwhile, I don't think that was the perception of the other folks in the room. And I tried to convey to her, and again, I don't know. I've never been in this situation myself, right? So it's really hard as a provider who has not lived with someone with PPA for an extended period of time, right, to provide guidance on this. But tried to couch it in the framework of, well, we need to be thinking about safety, right? Like if it's an unsafe situation, that's one thing, right? But if it's um, the person may struggle a bit, right? And there may be some uncomfortable moments for the communication partner. That's not a safety issue, right? That's a personal issue for whoever the communication partner is, but they will get over it. And I had to acknowledge that that's a lot easier said than done. But at the same time, as a clinician, we're trying to encourage people to put themselves out there and communicate and use their tools, right? Trying to hold them back because they might struggle is a challenge. That being said, I know it's really hard for the care partner to observe and be present and not jump in. Um, and so that's something that I've kind of struggled with, right? Trying to provide counseling for something that I've never been through myself. But advocating for the individual living with PPA, um, as long as they're in a safe environment.
And Mike, I'd like to follow up on that and what's really helped is I found as a caregiver, when people would notice that something was going on with Tara and then would come to me after the fact, hey, we're noticing this. Is everything okay? Is it that and that? And Tara has become so genuinely courageous and even somewhat new and informal friendships of just saying, this is what I have. This is what I need. I just need a little more time, a little more patience. I'll be able to answer you, but and once that was just openly revealed to even casual friends, it was like a burden off them of just wondering, worrying. Now they start to get the tools of how to
Yes.
communicate with Tara and just
Yes.
don't be hurried to like force an answer. Just give her some time, just processing time. But for Tara to just courageously just upfront with people on that, I was scared to do it. And it wasn't my place.
Yeah.
It really was Tara's, and she does it.
That's great. And you're right, and that's something that I wasn't talking about, but that's really important to, as part of therapy, work on the individual advocating for him or herself. Yeah.
Yeah, it's a nice component of having like a clinical space that's safe. Is kind of as the two of you were talking, I thought of two instances where, first off, it's like I'll get the spouse or the caregiver that asks, like, should I step in? Like, should I help them or should I not? Like, what's the right answer? What's the therapeutic recommendation? And like every time I turn to the patient and ask them, what do you want for them to do? And sometimes it's like it's 50-50.
Yeah.
There's never a consistent answer. It's, give me about 4 seconds, and when I look at you, jump in, and it's like that. Um, yeah, I
We
had
have
the
a
other thought,
visual
but
cue, and I'll just wait for Tara until she kind of gives me the nod. I'll just defer
exactly.
to her, and then I'm just, I'm like, and she's like, so.
Yeah, 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 and it's been good too with the self-advocacy, to do like script training, and it's like let's write a script of how much do you want to divulge to people, how much do you want to disclose, how much, so we write that script up, and then that becomes, part of our regular therapy visit is doing that practice.
And that script training can be really helpful too, because oftentimes when people are sharing, it can feel vulnerable and things that we're nervous to say before the onset of PPA, or for those of us who don't live with PPA or PPAOS, we script too. So just having it kind of over practiced, locked and loaded, can be, even if you don't need it really, and even if every time you go through it, it's perfect. It's like it just kind of calms the system so that when you go to say it, you're like, all right, I'm prepared. I got this.
And,
Um,
yeah, there's a question in the Q&A and in the chat. You may get to them later. I just want to
oh
make sure.
wait,
Yeah.
the Q&A and the
Yeah, they're two different places. So one in the
oh
chat, and then there's a Q&A button, and there was a
oh,
question.
thank you. I
Sure.
saw it in the answer. Okay. Um, what time did these come in? All right, Patrick. This may be outside of this brief talk, but I joined because I'm concerned to know what rights my husband has if he's in the ER or hospital as far as being understood and understanding. It seems like it could be a terrifying experience. What can I ask for on his behalf? I will let you guys take the first on that, and then I can add in some of my recent personal experience in this space as well.
Yeah, I think that, what I've seen with our, my colleagues in the hospital-based setting is trying to advocate for more access to a communication board. So just to like a basic needs communication board is I think the first place I would start as far as an answer of what to request. And that just includes picture icons plus plus the word itself for basic needs, basic comfort needs. So at least that can be communicated. Um, yeah, I think it depends situation by situation, but I also think of some good features that are available on smartphones that can help to get communication to come out too. But I would think basic needs communication board is what I'd be looking for.
Yeah, I agree. It would be, in an ideal world, um, training uh, physicians, nurses, other medical staff on supported conversation techniques would be it would be ideal because then they could use these techniques to communicate with anybody who comes in who presents with a communication challenge. Actually, in the training videos for supported conversation that were developed by the team in Toronto, where the techniques were developed, they show training videos with, I think it was neurology residents, who initially attempted to communicate with an individual with aphasia due to stroke, pre and post training with supported conversation, and the improvement in the ability to engage with, make the person feel comfortable, get necessary information, improve significantly following the training. Now, that would be a big ask, or it would be a lot to incorporate into every medical school in the country, but I do feel like that's a piece of the puzzle. Certainly something, and we have not done this at Vanderbilt University Medical Center, I don't believe, but something that could be implemented, I'm sure, with their new resident group coming in each year, because that is a critical that is an issue, and I think the pace of the emergency room, um, the focus on emergent care, usually stopping and taking time to communicate with someone is not a priority, unfortunately. But anyway, I think in an ideal world, we would train physicians to know how to use supported conversation.
And if I understood the question correctly, and I'm a lawyer's kid, so I always got that edge to me on that too. What are the legal rights of a patient?
Okay.
We're married. We've been to each other. We've got each other's backs legally and every otherwise. But if you're a care partner or a caregiver who is not a spouse, who is not a family member, can you speak for that person? This was a big push for us to finally, do, an estate and get all of those things lined up and done, clear through the board, so we don't have to worry about them in the moment. I mean, clear down through funeral expenses. Everything is taken care of. And so who's got legal rights outside of us as spouses in order? Our trusted family and friends that can speak for us if we cannot. So if you're not a spouse or family member, then what rights do you have? And it's got to be, and clinicians and medical, they've got to follow all, HIPAA and everything else to protect that patient. So that's all got to be thought about early. You can't wait till it's too late and somebody who's diagnosed can't speak for themselves because somebody might legally challenge they were not able to speak for themselves and sign off their rights. It's got to be done early.
There are some resources that I will link to in our post-session notes that I will email, and they will be posted on this event. Give me a couple of days to get them up on the website, but just some resources to kind of walk you through like the things, the checklist of all of these things that Morgan is talking about. And to Mike's point too, like in an ideal world that would happen. And it's not that hard. So let's just do it. So to any providers out there listening, and this is something we've been talking about in Darby lab and the behavioral neurology lab focused on PPA and FTD. And so we have our like geriatric fellows and our behavioral neurology fellows kind of go through um, sort of a PPA, PPAOS whirlwind, really, because we're talking about the medical side of things and also the communication side of things. But formalizing that would be ideal. And if you are interested in like providing a training or sharing those resources on the provider side, like straight up just pick up the phone and like call your, or it's 2025, email or 2026, email your a neurologist that sees a lot of people living with PPA and PPAOS, and I guarantee they will jump all over it. Anything that we are willing to offer in terms of the communication, the non-medical stuff, people are just all over it. Like, will you get paid for it? Will you have time outside your schedule or like built out in your schedule to do it? In my experience, often not. But if it's something you're called to do, I encourage everybody to do it. And then we have one more question from Linda in the chat. Can you describe the group that you're in with your wife? Does it take place in a physical setting? I'll let you guys speak to that.
No, it's all Zoom. Again, we're in again, somewhat of a desert of, there's one PPA support group that meets once a month about 40 minutes from here. And I find it almost ironic, like evenings are hard. We haven't gone around to talk about sundowning and that kind of thing. But so to go support myself, I'm supposed to go in the evening when things are the most difficult to go drive 40 minutes for an hour to get, no. So, it's this Zoom group or groups that Kiiya has set up for different purposes, be it social, be it scripting versus communication. I dare to say they're kind of the highlight of your week.
It is.
It really is. And nothing's
We've
like
got some fun.
that Zooms are, they're great.
I know. I'm like, someday we'll have to have we've never met in person, which is wild. I forget that all of the time because, like
Go ahead.
thinking of Morgan, like, and Tara sending me chicken soup that they made,
Yeah, chicken
imploring me
chicken
to like
soup in a tea bag.
chicken tea, imploring me to take care of myself, not asking me what I need, but like it's just a really like beautiful community that we've built. And in a clinical setting, we don't really have the opportunity to do that, which is, a big part of why I only work with a very small number of people that kind of just either mostly like friends of friends or friends of neurologist colleagues that I'm close with or patients of, I guess. And we just have like one little cohort of us that get together and do fun things outside of like, let's be human together. And we just happen to like, or many of us in the group happen to have PPA. So different, it's, not a model that exists really. It's very socially focused and, I'm there to be like, oh, here's a hot tip. But I learned more from you guys really than I could ever teach anybody. Like I'm constantly banking the strategies that Morgan and Tara and everybody that I encounter share within the context of these groups. We have at the NAA PPA chats on Fridays, every second and fourth Friday. And this is, ideally kind of set up to be a place for everybody, care partners, people living with PPA to come together and just discuss topics and share. It's harder on a national level, of course, it's just bigger. But, finding your little pockets within that is really nice, and shoot each other contacts in the chat because that's these like organic sort of relationships that can emerge from this a space you don't want to be in, right? Like if you know me or Mike or Zach, it's usually not for good news of a reason. But I think that, community building within these like larger communities can be really helpful. Um, I think it's Ilana said in the wallet or phone or bracelet, putting a note about primary progressive aphasia so that if you end up in the ER without a trained care partner, there's something in writing to point the provider in the right direction. This can be an important issue for legal too, or getting pulled over. Like, I have aphasia. I have
Yeah.
primary progressive aphasia. You don't have, you can say like, I have a communication thing. Like, you can have it say whatever you want, but it can be helpful. We have some of those posted at the NAA website. I will link to those as well. And I have one that's like kind of for all the four main variants: logopenic, semantic, non-fluent agrammatic, and PPAOS, the primary progressive apraxia of speech. And the top will say like, this might be a good fit for you if you have semantic PPA, but if you want them to say something else, like, you can totally edit them yourselves or shoot me an email and I can edit it and send it back to you. I've made ones for people that say like things in their own voice, like, shut up, I'm talking, I have PPA, like whatever you wanted to say, that's your voice on paper. So, but yeah, that is a wonderful point. And the bracelet, Morgan and Tara, yeah, the bracelet. And then any advice for finding an SLP that specializes in PPA? Oh,
That's a tough one.
this is the bane of
Yeah.
my.
I'll look to you, Mike.
Yeah. It's interesting. I had a conversation this morning with someone who works in she's PRN and works in a variety of assisted living facilities, right? So that's a tough job. That's like going in and every day seeing a new group of people and having the staff at those facilities turn over so rapidly. She was talking about the challenges there. And the reason I bring that up is that she was a very thoughtful clinician who, kind of regardless of her comfort level with a diagnosis, was going to think through it from a practical standpoint. And in particular, she was asking me about an individual that I had worked with in the Huntington's disease clinic. She didn't have a lot of experience with Huntington's disease, but just clinically doing her own, simple Google search and Google Scholar search, found information, made really, I thought, very appropriate decisions. Um, and and I thought, gosh, that's how this should work, right? So it's while it would be great to find an individual who has years of experience working with an individual who individuals who have PPA, if you find someone who is willing to look it up, right? Or do an evaluation and identify strengths and weaknesses and develop strategies to support um, those strengths and weaknesses. That's really that's what we do, right? Um, you know, there's a lot we don't know about PPA even now, and we're still able to provide care as speech language pathologists, right? And I think sometimes clinicians, if they hear a diagnosis and they're not familiar with it, push back and say, "Well, I don't do that," you know, when really what we're trained to do is treat the symptoms, right? I mean, or I shouldn't even say treats them, address the communication challenges that the person is experiencing. So it helps to know that it's progressive, right? And as long as you know that it's progressive and that this is going to change over time, I don't want to say that's all you need to know, but like at some level, that changes your framework, right? If this was a stroke and you expect it to get better, then that changes the trajectory. So I know this is not maybe helpful, but like if you can find somebody who's willing to put the time in, right, to think through the challenges and asks you, well, what difficulties are you having communication wise, and can talk through those things, right? Then you found a good person. Because you don't necessarily have to have years of experience working with this specific population. You just need to have experience thinking through how to support individuals with communication challenges, right? Right. It doesn't almost doesn't matter what the diagnosis is, right? I mean, I say that knowing that it does, but like the clinician, regardless of diagnosis, should be able to at least come up with a plan of action. So that's how I feel about it. And so there are a lot of really talented speech language pathologists out there who are
Ooh,
willing to do that.
But
But it's finding that person. They don't necessarily have
we
to have
lost everybody
specific experience
somehow.
with PPA.
um, yeah, I think finding someone that you trust that feels good in
Yeah,
your gut and that is dedicated and got a good head on their shoulders that is
yeah,
going to make that extra. I have some of my like really my closest friends who are have become friends because like a neurologist that they work with who like trained with one that I worked with, they reached out to them and like, where can I like learn more about, neurodegenerative syndromes? Like what's out there for speech pathologists? And the neurologists were like, I don't know. Here's Kiiya. Like she probably knows somewhere. And we just end up um, having there's not a lot of opportunities for us as clinicians to like collaborate and work together and bounce ideas off of each other unless like there's a few settings in which there's that time. um, and so from the provider perspective, just like connecting with other providers, and if you have um, you know a speech language pathologist who is like, I haven't done a ton of this, I'm not super familiar with this, but like I'm reaching out to my network. Like, I think that's a great green flag right there.
yeah,
And if there's somebody that you can like start with, um, you know, and see them to kind of get the critical information first and get kind of a good setup going. And then you can go to, any therapist that is, in the cognitive communication space for adults. Once
yeah.
you have, once you have the, that kind of foundation, you've had those questions answered and things like that.
Yeah.
Mike, I'm gonna steal your word couch. That's my new. I love that you've used that a few times now. But I never devalue the 7 degrees of separation. So even if you just, if you're super remote and, we have the advantage of being educators for so long, so we know speech and language pathologists, but nobody knew about this. But hey, I knew somebody in Klamath Falls. Klamath Falls knew somebody at OHSU. Then that's how we worked to Kiiya. It was just this ping pong around. We tried somebody locally that was a speech and language person, in person, and relationship wise, it was just not a good fit at all. We knew
Mhm.
that. We knew that like after one visit
Yeah,
that
yeah.
like, nope. And it was a much better fit to Zoom, Vanderbilt than it was to try to fit this square peg round hole kind of a feeling. So just keep touching base. Somebody will know somebody. I don't care where you are.
And even if, let's say you find somebody that you do connect with in person and they are willing to put the time in, right? And you have that connection, it is perfectly fine. Encourage them to reach out to, like, to your point, Morgan, like reach out to someone who may have more experience, right? I mean, I don't think Kiiya would mind me saying that she would be happy to. I would be happy to, and Zach, I'm gonna throw you out there too. But like, anybody who does this work, right, is going to be happy to talk through a case with somebody, right, and say, why don't you try this, or tell me more about this, and what have you done? Okay, that's good, but this has kind of worked in this situation for me, right? And it's a back and forth, and I mean that's exactly what happened this morning with
Yeah.
this SLP, right? She was doing a great. I learned from her. She shared with me her experience working in an assisted living facility, which I've never done. And she put into context some of the things that I was recommending. It's like, that might be a challenge for this reason. Okay, well, let's think through that, right? Um, so yeah, have them reach out to someone, to your point, like finding someone at Oregon Health Sciences, right? Like they'd be happy to, I'm sure, spend, half an hour talking about a case.
Yeah, we're in this field because we like to help people.
Yeah.
So we're really, really happy to help people. Yeah.
Right, we are at 6:01 my time, 7:01 Eastern, where the NAA is based. So we will wrap it up here. A million other things that we could talk about. But this will be available for on our YouTube page, and I'll put together all these recommendations and ideas that that were shared with us today, so they can be found in one place. And if you have any questions or concerns, I will put the PPA Aphasia. I can't talk and type. PPAOS Aphasia.org. Shoot any questions there anytime. It's just me on the other end. So I feel like sometimes I'm like, here, this, and then people keep coming up and it's just Kiiya. But if I don't have an answer for you, I will track one down. So
And I'm just going to say that, I don't have many answers. I just know Tara, and I know what we create together. But any, care partners out there that are new to this, or just, kind of want, run it through Kiiya, you can share with people if they reach out to you, just from my point of view and our point of view of where we are, where we've been, where we are, and where we're going. I'd be more than happy to help out.
yeah, Morgan's been a great resource, as has Tara. Very lucky to know all four of you in this room. Five, me too. Somebody wants some attention. All right, thank you all for joining tonight. Wonderful, wonderful discussion. I value your expertise.
And I see someone's asking about an SLP at University of Maine. Are you looking for
Oh,
someone, or somebody? Because there is a faculty
I
member there,
think
Jessica Riccardi, who does work in aphasia, but she may be a resource for PPA.
I think she might be an SLP at university. Yeah,
Oh, she
okay.
is an SLP. Oh, gotcha.
Um,
Okay, great.
I'm like, send me your contacts, girl. Let's
Yes.
put you on the list.
Well, nice to meet you.
Alrighty, thank you, everybody. Have a great night.
Thank you all.
Thank you.
Bye-bye.
This is what we do in our groups. Me and Tara. Bye, guys.